Hello, friends. My name is Veronica Sierra. I'm a licensed dietitian, and today we're going to talk about a very important topic, which is inflammation. This is known as the silent killer because it's related to many diseases and things that affect our overall health. To tell you a little bit about my background, I'm Mexican. I moved to Florida in 1999, and nutrition has always been my passion. I love to give people more tools to improve their diet and well-being and to prevent to improve their lifestyle and prevent chronic diseases. So let's get started. So inflammation is known as a local response to cellular injury. The principal signs are capillary dilation, leukocytic infiltration, redness, heat, pain, swelling, and loss of function. Some of these symptoms, they occur internally, so we cannot be very aware of them, but some of them we can notice whenever we have an injury or we hit ourselves, we can start feeling the pain, the heat, the redness, and the swelling. This is due to some proteins that are called cytokine, that are immunoregulatory proteins, and the better known are the interleukins, the tumor necrosis factor, and the interferon. So we have already mentioned that inflammation is the body's process of fighting against things that harm it. And this can be related to some infections or injuries or toxins. So then an immune reaction starts activated to attempt to heal. And there's a greater damage to cells that promotes the release of these chemicals, and it turns out to be like an immune response. So as you can see, inflammation and the immune response are very related. Now, there are two types of inflammation. One is known as acute inflammation, and this is something that happens in the moment. And the other one that we're going to see a little bit later is the chronic inflammation. So acute inflammation usually occurs during an allergic reaction, some chemical or irritants to our skin or our body, infections, trauma or injury, some burns, laceration, cuts or wounds, or frostbite. So what happens that when we have these events, there's a release of antibodies and these proteins that we have already mentioned. There's an increased blood flow to the damaged areas, and this acute inflammation can last for a few hours or days. Now, the other type is chronic inflammation, and this is a constant state of alert. So this can last for months or years. And this is a worse damage to our body because it starts altering proper function of our cells and causes DNA damage. It also affects many different body systems and organs. It promotes tissue death and internal scarring. So it's very important to address this chronic inflammation to prevent or treat chronic diseases. Here we can see how the environment or genetic factors can promote inflammation and all the consequences that inflammation can have in our bodies, such as cardiovascular disease, musculoskeletal and skin diseases, cancer, reproductive diseases, respiratory diseases, neurological. Also, obesity and metabolic syndrome or metabolic diseases are very related to inflammation, as well as immune diseases or autoimmune, which are more and more discovered or more and more presented in these days. Which are the most common symptoms of this chronic inflammation? They are fatigue, fever, mouth sores, rashes, abdominal pain, and chest pain, among others. There's an important marker that it's called the C-reactive protein. So this is kind of the gold standard for the doctors to detect how inflamed we are. And this is a protein that it's produced in the liver in response to an inflammatory signal. It usually elevates very quickly with an acute illness or a bacterial or viral infections. and we can really see or monitor how inflammation is going. So usually when you're at the hospital, they can make a test to see how you are, and they can keep monitoring the levels of this CRP and see if the inflammation is reducing. Like if you're getting better, these levels are going to start decreasing. So a CRP of more than 3 give us like a higher or even triple your risk of heart disease. And that's why when we are hospitalized, we get a little more chance of getting these complications because of this acute inflammation. It also increases the risk more in men than in women than in men. And it can be an indicator of the risk of developing diabetes. There are some other markers, which are the erythrocyte sedimentation rate or the blood plasma viscosity and the interleukin-6. These are other markers, but usually the C-reactive protein, as I mentioned before, is the gold standard. There are some risk factors that elevate the CRP, which are cigarette smoking, obesity, or overweight. We can see that usually the CRP is higher in these individuals. Also, when people are presenting insulin resistance, their levels of CRP tend to be higher, such as with metabolic syndrome, and it can be a predictor of type 2 diabetes. Usually, the standard treatment for doctors is to use this NSAID, which are the more common anti-inflammatory medications, and they have a good benefit for the body. They are effective, but the point is that they can have some secondary effects, especially if you take them for a long while or for a long term. They can promote death, myocardial infarction, gastric ulcers, or bleeding, versus the omega-3s that they also have very positive effects on inflammation and no side effects reported. So omega-3s can be a good alternative to reduce inflammations with no side effects. There are many studies that sustain these affirmations or these claims, and they have done it in different group people where they have proven the importance of omega-3s as an anti-inflammatory supplement or as a nutrient, which has very good anti-inflammatory effects. So in this study of 250 patients that were included, 125 returned the questionnaires after taking the omega-3 supplements for 75 days. Like 78% took 1,200 milligrams and 22% took the double dose. And all of them reflected benefits, and they were happy with the results because they improved their symptoms. They were overall happy with the results, with their joint pain, their general pain, and they were willing to keep taking the omega-3s with no side effects reported. In these other studies, where we see how fish oil can reduce inflammation, they analyze these special molecules which are called pro-resolving mediators. And these ones, they have a powerful effect on white blood cells, as well as controlling blood vessel inflammation. So in this study, they realized how the use of omega-3s can reduce the blood, can increase the circulating blood levels of these mediators. So they promote to reduce inflammation. Also, they increase the immune response against bacteria, and they decrease the activity of the blood clotting. In postmenopausal women with hormone replacement therapy, they were also very good results observed because they gave them a supplement with fish oil, and they monitored their CRPs and their interleukin levels. So they see a significant decrease on these markers. Also, the decrease on the triglycerides and the ratio that relates the triglycerides with the HDL cholesterol. And they saw a reduction of the incidence of cardiovascular disease. So it's kind of a cardioprotectant, and especially in these women with hormone replacement therapy, that this is like a secondary effect of the therapy, the cardiovascular risk. So it's a very good option to combine it with omega-3s. Okay, so how can we relate our diets with the levels of CRPs? Well, we can see that an increase of consumption in fiber can significantly lower our levels of CRP. Also, that weight loss improves our inflammatory cytokines, so we reduce inflammation if we are able to lose some weight. Also, that the saturated fat intake can increase the levels of CRP, so they promote inflammation. On the other hand, if we consume EPA and DHA, which are omega-3s, we can reduce these CRP levels. And it's important to recall and to understand that there are different types of omega-3s. There's one that it's called alpha-linoleic acid, which is a precursor of DHA, but the conversion is very poor. So it's important to consume fish sources or marine sources such as algae to get good levels of DHA and get these therapeutic effects. But it's important to keep a diet high in polyunsaturated fatty acids and also in these alpha-linoleic acids. So a good variety of nuts, seeds, avocado, and fish sources, it's important to get good levels of omega-3s. Some foods that are considered anti-inflammatory foods are fruits and vegetables. Try to look for organic ones to avoid the toxins and the pesticides. But remember that these foods are packed with phytonutrients and especially polyphenols, which have a lot of benefits to our body. If you're going to consume animal products and meats, try to look for pasture-raised meats free from antibiotics. Also healthy fats, such as the ones that come in fish, nuts, and seeds. And we have to look for nutrient-dense diet. This means that we really get a good amount of these phytonutrients, these vitamins, minerals, protein, besides just empty calories that we normally get from the foods that are kind of fast foods or that they don't have many nutrients. There are some other spices that they are also high in these phytonutrients and polyphenols, and they have anti-inflammatory effects, such as turmeric, garlic, ginger, and cinnamon. And as you can see in the picture, we have plenty of colors, which are the polyphenols and these phytonutrients. But besides giving the color, they have a lot of good effects for the body. The omega-3, omega-6 ratio, it's another important marker that it's something that you can do in your house. And this ratio also relates a lot to inflammation. So for every 3 omega-6, you might need to have 1 omega-3. And as you can see in this picture, usually we tend to eat a lot of omega-6 and very few omega-3s. Because omega-6 are everywhere, and especially in modern diets, which are pro-inflammatory. So we need to give our bodies a good amount of omega-3s to try to balance this scale and to get into an anti-inflammatory state instead of a pro-inflammatory, and avoid so many detrimental functions for our bodies. So usually we need to give our body some nutraceuticals to give this support, because unfortunately our foods now are not as nutrient dense as they used to be. So it's hard to get therapeutic doses just from food. So I'm saying that it's important to have a nutrient-rich diet, a healthy diet, but to prevent many of these diseases, you need to support your body with these nutraceuticals, which refer to nutrients or food supplements that have a positive effect on health because they function as antioxidants. They help us increase our cellular energy. They promote cardiovascular health, digestion and absorption of nutrients because they improve our metabolism. Also, the elasticity and resistance of our tissues, skin, and organs, it's improved. Our osteoarticular health, and of course, we're preventing chronic diseases and maintaining our overall health. In Cincino, we have good quality nutraceuticals, and this one is my favorite, which is the Balance Oil, because it's a supplement that contains 3 nutrients in one, and they work synergistically, such as the omega-3s, which have a good amount of EPA, DHA, and DPA, which are the ones with more benefits for our bodies, and they come from wild fish or algae. Also, they have polyphenols from olive oil. And remember, polyphenols, they work synergistically with the omegas because they serve as a carrier. They have a good affinity for our cell membrane. So the polyphenols help the omega-3s to really get into our cells and gives all these benefits. And also vitamin D3, remember, is a vitamin with many, many good properties for our bodies, such as an antioxidant. It helps absorb calcium. It prevents cancer. It gives us cardiovascular disease, brain protection. It has many, many benefits. So vitamin 3, it's liposoluble or fat soluble. So it needs the fat to be able to absorb. So as you can see, these 3 nutrients, they work synergistically in one product, which is the Balance Oil. So I really, really like this product. Now, to get an idea of how is your omega-6, omega-3 ratio, Cincino offers this test that it's a home-based test, very easy to do, and it's called the Balance Test. So this test is gonna give you your omega-6, omega-3 ratio, also your fatty acid protection value, how is your index of omega-3s, your mental strength, your membrane fluidity, and also how is your formation of alpha arachidonic acid. So it's very important. It gives you a lot of information, and it's performed for a very well-known lab, which is called Vitas in Norway. Besides the omega-3, we have some other products that they work synergistically, as I'm saying, to improve our health. This Viva, it's a product made from saffron, so it has no psychotropic effect. And what it does, it helps us to balance our emotions and reduce stress, but will also promote our sleep. Remember, sleep is very important for our bodies to recover, but also stress promotes inflammation. So chronic stress promotes chronic inflammation. So Viva is going to help us to improve our emotions and also reduce this inflammation. Extend is a multi-nutrient, which is packed with vitamins, minerals, and some other phytonutrients, and these fibers that are very important to support our immune system that are called the beta-glucans. So it's going to help us improve all our metabolic functions. We're going to feel more energized, and also our bones and joints are going to be benefit from this supplement. So as you can see here in this picture, we have this health protocol. I have already talked about the Balance Oil, the Extend, and the Viva. And we have one more product, which is called the Cinobiotic. This is a prebiotic supplement that it's going to help us maintain our intestinal health. And remember, our intestinal balance is very important because it has a direct connection with our brain and with our overall health. So if we improve our intestinal health, our overall health is also going to notice and be benefited from it. So as you can see, we're covering with these 4 products our overall health, and we're going to start to feel better as we start with this protocol. Another important thing to mention is that all these claims are approved by the EFSA, which is the European Food Safety Authority. This is the equivalent of the FDA. So all the claims that are listed here have been approved and proved. So you can rest assured that you're taking a very high quality product, that it's free from any toxins or any pesticides or any chemicals, and that you're going to start noticing all the benefits in your body. So then my last question is, if you could be living a better life, why wouldn't you start now? Thank you very much for your attention, and I hope this information is helpful for you.